Welcome to Ideagen TV. Today we have with us Christina Shapiro, President of the Impact Fund for Children at UNICEF USA. Christina, welcome.
Thank you, George. It's a pleasure to be here with you today. Thank you for having us.
You know, Christina, it's always incredible to have global leaders and luminaries, individuals that can see around corners on Ideagen TV, and you are that. You have the uncanny ability to see around corners as you work at UNICEF USA to literally change the world. Today, we're especially ecstatic and excited to hear from you and the incredible panel you're about to introduce. Christina, take it away.
Thank you, George. Before I introduce my colleagues, I wanted to highlight the relevance of the topic today. And I wanted to start with key statistics because that frames the issue, and that is that immunization saves 2 to 3 million children each year from deadly childhood diseases like measles, diarrhea, and pneumonia, and are the most cost-effective child health intervention. And that is why I'm honored to be here today with my colleagues Richard and Alyssa to discuss UNICEF's leadership role in immunization and why immunization is so critical to SDG 3. But what you'll hear is that it's critical to so many other SDGs. So first, I'd love to introduce Richard Duncan, who has worked for UNICEF since 2014, leading their workstream on immunization equity and ensuring immunization services reach the most disadvantaged children globally. I'm also thrilled to have with us today Dr. Alyssa Sharkey, a senior health specialist and acting chief of the Implementation Research and Delivery Science Unit in UNICEF's Health Section in New York. Her current focus areas are on equity and immunization, implementation research to improve health programs, and gender-related barriers to health services. Richard and Alyssa, welcome. Thank you. Thank you for being with me today.
Thanks, Christina. Very happy to be here.
Great to be here.
Thank you. So as George said, he thinks I have the ability to see around corners. I think that's the two of you, not so much myself when it comes to this topic. So Richard, I thought it'd be helpful before we kick off for you to explain to our audience UNICEF's role in the immunization of children around the globe. On to you, Richard.
Thanks, Christina. So look, UNICEF's role for immunization is incredibly important and incredibly far-reaching as well. UNICEF is the main supplier of vaccines globally to children. I think we sort of target about over 99 countries, about over 45% of the world's children actually receive vaccines through UNICEF. But more importantly, UNICEF's got an incredibly important role in sort of identifying, targeting, and bringing those most marginalized children and communities into the programs and the support that both UNICEF, governments, and all other partners provide. Over.
Richard, that's amazing. I think I was shocked when I joined UNICEF USA to learn that UNICEF is responsible for immunization for such a large portion of the world's children. I'd like to invite you to share a presentation where you can walk us through the status of immunization today, why immunization is an important investment, not only for SDG 3, but for so many others, and lastly, what are the biggest opportunities we have yet to tackle? And in particular, I've heard you talk about zero-dose children and why starting with zero-dose children is the path forward in terms of achieving equity in immunizations. Over to you, Richard, and on to your presentation.
Thanks, Christina. Very happy to give this. So look, today's presentation, look, I'm just going to give a quick overview of where we've come from globally in immunization and where the challenges are going forward, and particularly where UNICEF's critical role here is in addressing these. Next slide. So again, that's just the presentation outline. But I think what's most important is where we land. And this is looking, as you mentioned, Christina, on the importance of this focus of zero-dose children, which I'll actually explain as we go through the course of this presentation. And also some of the new innovations that UNICEF is introducing, particularly how we're using gender to start to tackle some of the disparities around immunization coverage, which Alyssa will take forward in this presentation as well. Next slide. So, as I mentioned, UNICEF is the world's biggest supplier of vaccinations. We every year we go through about $1.45 billion of vaccine procurement. It's over 2.36 billion doses, and that's 2,628 shipments a year, which is approximately 8 or 9 shipments a day. So that gives you an idea of the volume and the scope of UNICEF support. You can see it's a huge range of countries that we support here, primarily across Africa and Southern Asia, but UNICEF has a huge global reach in terms of both the number of children it supports with vaccination services and also the number of countries we support as well. UNICEF support is not just for vaccinations, it's all the additional consumables and sort of technologies that are required to actually keep vaccinations safe and potent from the time of production all the way through to the point of delivery. We also support safe injection equipment, and particularly we're hugely invested in the immunization supply chains, and particularly the cold chain equipment, which is critical, again, maintaining the potency and effectiveness of vaccinations. Next slide. You mentioned, Christina, about the importance or the cost effectiveness of immunizations, and I think this slide here shows it very markedly. Immunizations is one of the most cost-effective and impactful investments governments, partners, and the global community can provide. For every dollar that we spend on immunization services, that has a net benefit to countries of approximately $16. That's the benefits that actually countries accrue through savings in healthcare costs, savings in lost productivity, and savings in additional lost costs due to illnesses, and additional benefits through education and development of children. If we compare this to many other investments in terms of public health, preschool education, community health workers, cardiovascular research, which are all very important, immunization is definitely there at the top of that list. And again, that reinforces the importance and the value of investments in immunization services. Next slide, please. So I think we mentioned at the start of the presentation the importance of SDG, and this is really the global forum and sort of framework to bring together all countries and target on specific focuses around sort of equity and development for nations and their populations. And I think what's very important here as well is immunization central to not just the specific SDG targets around reducing inequities and better health, but also across all SDGs as well. We support into an investment immunization supports improved learning. Children actually not sick, they're able to attend schools. It supports productivity in the future through improved health workforces. Many of the innovations that actually come into health systems have been driven through immunization services, and particularly their focus and their ambition to try and reach the most disadvantaged children. Technologies around cold chain equipment, solarization, which is not just of a benefit for keeping vaccines cold, but also for actually, potentiating or sort of driving community development as well. There's a plethora of support, or there's a plethora of impact that immunization has just beyond its immediate focus on protecting children's lives. Next slide. So where are we today? I think that was one of the central questions you asked, Christina, at the start. I think we can actually say, look, immunization has had an incredible success and impact globally. Today, 85% of children globally are reached through immunization services. And this is a huge uptake from 40 years ago, where it was around 30%. Even 20 years ago, it was around 70%. So I think the immunization program vaccinates approximately 116 million children each and every year as we go forward. And I think that's a huge achievement that should be celebrated. But at the same time, we are not achieving universal coverage. There's approximately, I think it's roughly 20 million children every year that do not have full access to immunization services. 16 million of these children have actually no access to immunization services. And that's what we call, as you highlighted in your opening remarks, Christina, zero-dose children. Zero-dose children are children that have that receive no immunization services during their first year of life. And not only is that an issue for the individual child themselves, but also zero-dose children tend to be concentrated in disadvantaged and marginalized communities where inequities and social disparities are at their greatest. And this is the interface of where UNICEF's most effective, and that's where our ambition is as well, to really drive services to those most marginalized and disenfranchised children and communities as well. What we do know, zero-dose children are not distributed globally in any random fashion. They actually concentrate in a subset of countries. And these countries are actually up on the slide here. It's India, Nigeria, DRC Congo, Pakistan, Ethiopia, Philippines, Indonesia, Angola, and Mexico, and Brazil. And I think what's important here is there is an association between national wealth and zero-dose children, but also too, it's not universal. Zero-dose children and children not receiving immunization services are not just concentrated in the low-income countries, but it's also spread across the middle and high-income countries as well, which really reinforces UNICEF's global role, not just in a subset of countries where disparities are or national incomes are below us, but also its key role in trying to ensure all children's rights are actually universally received, regardless of the country context that children live in. Next slide. So a little bit more of a deep dive into zero-dose children. One of the key things from our analysis in UNICEF we see very precisely, zero-dose children and poverty are interlinked. The chance of a child or a community will actually have a concentration of zero-dose children is very much aligned with the level of wealth. The poorer the community, the greater the chance children will not be receiving immunization services. And it's not just routine immunization services we're talking about here, but this zero-dose children are a very precise and effective marker for children not receiving other health and social sector services, education, safe water, sanitation, etc., in addition to immunization. These children, through their lack of access to government and social services, not just vulnerable for lack of preventive care, but also for disease outbreaks. And often we see that many of these explosive disease outbreaks, like polio outbreaks, measles outbreaks, yellow fever, cholera, are concentrated often in these zero-dose communities, which also has a flow-on effect or impact in other communities as well. And I think what we're trying to work towards within UNICEF, and I think it's one of our organizational strengths, is to bring our focus on zero-dose children from immunization in step with a broader component of other social services, which UNICEF can actually cover that whole spectrum and ensure we bring a comprehensive package of health and social care to these communities, which provides them with a pathway for future development as well. Next slide. What do these zero-dose communities and children look like, and where are they most concentrated? I think our analysis, again, in UNICEF shows that zero-dose children are predominantly identified or sort of found in remote rural communities, increasingly in urban slums, also as the global community, Africa, South Asia, moves towards urbanization, and also areas affected by conflict. Our estimates increasingly that the areas affected by conflict are an increase in sort of context where zero-dose children are concentrated, which again is understandable given the increase in conflict over the last 10 years or so as well. One of the things is, as we get towards these contexts of social marginalization and social disenfranchisement, issues of gender disparities and gender power structures within these communities become much more pronounced, and this is something Alyssa will take us through during her presentation later. Thank you.
Richard, thank you so much. It's fantastic to see the progress that UNICEF has enabled throughout the world, but clearly you highlight how much more is left to be done, and you make a very compelling case for zero-dose children approach. You highlighted the integrated role of immunizations, and I think one area that's top of mind for a lot of people right now is COVID, and in particular, would love for you to talk about the impact that COVID has had and is having on immunizations across the globe.
Thanks, Christina. So, look, COVID's impact's been quite sort of slow. Yeah. So look, COVID's actually had a huge impact on immunization programs, particularly at the start. There was a lot of fear, apprehension, and misinformation that was out there, and I think that put a lot of concern amongst the parents and also amongst the health workers as well. Many immunization programs are delivered, obviously, at face-to-face with the community, so you've got that risk of interpersonal contact. Also, often many of our biggest immunization campaigns or our biggest immunization interventions are given in a campaign format where we try to vaccinate huge numbers of children in a day, which increases the the interaction between health workers and communities amongst themselves as well. There's many solutions here. I think we've shown we can actually provide immunization services through elements of social distancing and improved personal protective equipment for health workers. Also, too, there's a lot of misinformation out there as well, which I think UNICEF is working very hard to tackle and try to actually provide effective ways for health workers to provide immunisation services, and also the community to actually have the trust in those services as well. Beyond the immediate impact in terms of immunisation delivery, there's many, many longer-term risks here. COVID we can see is having a disproportionate effect on economies. As economies shut down, we're losing money that governments traditionally have access to through taxation and development to provide for health services and immunisation programs. And there's a real risk that many countries that have actually made huge achievements in immunisation coverage in the last 10 to 15 years could backslide in their efforts, primarily because they don't have access to the money to continue the procurement of vaccine, the payment of health workers, and the delivery of immunisation services as well. Over.
Richard, thank you. I know later on we'll talk a little bit more about the critical role of financing in ensuring that immunization campaigns can move forward. Staying on the COVID topic a little bit, I think you had shared with me a slide that we didn't show, but that showed how some of those campaigns had been put on hold. Are you seeing some of those campaigns restart in certain countries based on the efforts of UNICEF providing PPE to frontline health workers? Are you seeing that get back on track, or are a lot of those campaigns still stalled?
So good question. I think in terms of a universal response, it's really sort of country specific. Some countries are actually moving ahead. We've got some good examples, countries like Sri Lanka and other countries as well, that have managed to have very effective systems to actually get back to where they were before. Other countries are being challenged through cost. I think, the new framework to actually roll out the campaigns in the future, particularly given the additional expenses around protective equipment, efficiencies around sort of session sizes and things like that, actually making to do what we did in the past much more expensive. That's additional costs that need to be found in an environment where actually the access to resources are starting to decrease as well. The other issue too is that often when campaigns go back or are reinstated, we're not achieving the same levels of impact or coverage, again, because of that concern and fear from many individuals, again, the health workers and the communities. And that requires additional investments from UNICEF and engagement to actually try and overcome and sort of, help sort of provide, objective, correct information to parents and mothers and, the people that get their children vaccinated to ensure they've got they can make sound choices about receiving immunisation services as well.
Richard, thank you. That's very helpful. Highlighting the value of the community engagement is really valuable. And Alyssa, I think this question is for you, which is how based on your expertise, how is UNICEF, or how should UNICEF rethink immunization strategies to guarantee greater effectiveness?
Well, thanks so much, Christina. As Richard mentioned, we're learning a lot right now about these zero-dose communities and about the key challenges that people living in these communities are facing, what their aspirations are, and about the specific journeys that families have to take to get the immunizations they need. So all of this requires a bit of a rethink. Especially in light of the current context and all the challenges that COVID is bringing. So one thing we are doing is considering the role of gender as an entry point, which we're finding is quite helpful to more appropriately position our programs to meet the needs of the most disadvantaged, even within the zero-dose communities. I think in the past, maybe many within the health community didn't think there's much that we could do about gender, but now we know that there's actually quite a bit that we can do.
I know you have a short presentation, and would like for you to walk us through what that gender lens looks like. So what are some of the challenges and recommendations that you've come up with your team based on a gender lens approach? Over to you.
Great, thank you. Okay, so when the slides come up, maybe I can go ahead and start. Yes, great. So traditionally, I think when we within the global health community have thought about gender, that thinking has been really limited to, for example, whether or not there are differences in whether boys or girls were more likely to be immunized. And then in some cases, we're also considering differences in immunization rates by education of the mother, which we know is an important determinant of all aspects of child health. Next slide, please. However, so now our approach aims to recognize the fact that there are a whole range of gender-related factors on both the demand and supply side that can affect the likelihood of childhood and adolescent immunization, and that can undermine immunization programs' achievements. So we also understand that gender on its own isn't a problem, but it's rather how gender interacts with other socioeconomic factors, such as Richard mentioned, poverty, wealth, education, ethnicity or caste, religion, geographic setting, and migration status. These are all things that can influence both the immunization disparities and the outcomes that we see within countries. Next slide, please. So understanding how gender influences whether or not children and adolescents are immunized is key in addressing existing inequities. So for example, mothers, who typically we know have the role of the primary caregiver, can face significant socioeconomic, demographic, and cultural barriers that further compound all these challenges that we see in many contexts. They often have lower status in both their households and communities, and they have a limited capacity to act and take decisions on their own. They have many physical and time barriers to accessing immunization services. For example, having to walk long distances or finding time to access services for their children when the services are open. Many caregivers have limited education as well as poor health literacy. And finally, experiences they endure of poor service quality can have a significant impact on whether or not they seek health services for both themselves and their children. These are examples of the ways in which we know gender can influence caregivers, but there are also gender implications for the healthcare workforce, and we're exploring those as well. Next slide, please. So UNICEF is working hard with a range of partners to help countries use a gender lens as an entry point for understanding and responding to the equity issues in zero-dose communities, whether they are remote, rural, urban poor, or affected by conflict. Some of the key recommendations that we're taking forward with these partners include working with countries to incorporate analyses of gender-related inequalities and barriers into the assessments that they're doing. Leveraging funding options to provide support for pro-gender strategies, which we know from our analyses can make a big difference in program success. Using participatory processes, like a human-centered design approach to ensure services are gender sensitive. Integrating community-based monitoring and ensuring better measurement of gender-related issues within national plans and strategies. And then finally, with more and more countries rolling out HPV immunization services, UNICEF is working with countries to integrate this life-saving intervention into the platforms that make the most sense in each setting. We're excited about this area of work, which is quite innovative, and it changes how we do things with our country partners, and we think will make a big difference in improving equity, particularly within zero-dose communities. Back to you, Christina.
Thank you, Alyssa. To put you on the spot a little bit, I would love for you to bring to life one example of what a gender focused strategy looks like. An example where you're starting to see how effective it can be. If you can give us an example, over to you.
So certainly one example that's used a lot is to improve health literacy, for example, not just of the female caregiver who's often the target of these types of activities within countries, but also of other household decision makers, and engaging those same decision makers as partners in broader efforts to care for the child's health needs, to ensure that those children get the immunizations they need. That's one example. From the service delivery side, simple changes like changing clinic hours or the days that services are offered can often help those who, for example, are working and might not be able to reach the services when they're open, if those extra hours and days aren't included. So other efforts to build the capacity of health workers to improve the service experience. And then another example is in some communities, having a female provider may be important to the local community. So that's something that, that we support with our in-country partners to make sure that where that is important, those female health providers are available. Those are just a few examples.
Thank you. That's really helpful to ground, the myriad approaches that you need to take to ensure effectiveness, even just centered around a gender lens focus. So thank you for those examples, Richard and Melissa. I think at this point, you have clearly highlighted the value of immunization and some of the challenges that are still ahead of us. I want to pivot a little bit to the financing role. And Richard, you started to talk about it during our prior conversation, and the importance of financing to ensure that there's enough immunization happening at the right time and at the right places. For context, 10 years ago, we launched the Bridge Fund, which is a revolving loan fund that provides UNICEF with short-term funding to purchase primarily vaccines, but also other critical health and nutritional commodities. And since then, we have accelerated over $350 million to UNICEF from private investors to fund these types of commodities and have been able to repay our investors at 100%. So we've seen that the ability to attract private capital to help solve some of the challenges around immunization. What I think would be helpful, Richard, is if you can help bring to life the value of time, having the right vaccines when you need them, not just having them once funding comes in. So over to you to bring that to life for us. Thank you.
Thank you, Christina. Very good question. So it's really about the importance of speed in terms of actually addressing some of the needs of children. And I think what's critical there is that often you've got two parallel systems. You've got, particularly it's most evident in a disease outbreak where time is of the essence. The sooner you can get into these communities and actually run small scale vaccination services that are actually appropriate to the level of risk, I think not only can actually often bring disease outbreaks under quicker control, we can also actually have a much longer impact in terms of actually preventing their spread into other communities and actually making it much more cost effective. The trouble is you've got a disease goes at one speed, but also often financial and procurement systems go at another speed. And usually the main limitation or sort of bottleneck is the access to money. And often, countries, particularly where disease outbreaks occur, don't have that same level of speed and flexibility in terms of accessing additional money when disease outbreaks do happen. And I think this is where the Bridge Fund is incredibly important and impactful, in that it allows countries, or it allows UNICEF to proceed with the procurement of vaccines, ship them out, while giving the countries or other partners time to actually sort of identify the sources of those funds, so immunization services can occur as soon as possible. I think we've seen in many instances where rapid interventions for disease outbreaks have actually had a huge impact, and also a much longer term cost or lower cost in terms of what that true cost of that outbreak would be if we didn't actually have that same time frame or sort of access to vaccines at that earlier point in time as well. It's not just for routine programs. Often, country cycles and their flows of money within their systems go up and down, but children actually, they need the vaccines on a regular time schedule. And the flexibility that this Bridge Fund financing allows is for UNICEF to maintain supply of vaccines to countries in a consistent way, which allows, again, immunization programs to have that consistency in how they actually access and provide services to children as well. Thanks, Christina.
Thank you, Richard. Earlier, you talked about how the children that are the zero-dose children or the under-vaccinated children are not just in what a lot of people would think are the low-income countries, but you also included some middle-income countries. Can you talk about that a little bit more? I think our audience might be surprised that it's not just in the poorest countries around the world where you'll see under or unvaccinated children.
Good point. And I think, look, this actually goes back to the presentation around the SDGs as well, in that what we've seen the last 10, 20 years, enormous sort of global growth in economics and things like that. Many countries that were previously low-income countries have actually sort of got wealthier. They've actually sort of graduated or moved up the income scale into sort of the low middle income country context. But that doesn't as countries get richer, it doesn't necessarily mean they take their whole population with them. Often what we see, again, in a country that has significant inequities in terms of sort of the distribution of wealth, as overall country wealth increases, you still actually take a cohort of often extremely poor communities and children and families into that next sort of graduation or sort of scale as well. Other countries, many in South America in recent years, because have always been relatively wealthy or sort of middle income context, but they've gone through huge financial crisis, which actually has sort of exacerbated their ability to provide, basic health services, procure vaccines, which have often led to increases in the number of unimmunized children, and particularly zero-dose children as well in those countries. So I think the important thing here is that immunization is a universal child right, but it's not something that's realized in all countries, and the country context does not necessarily define how effectively that right is sort of realized by children as well.
Thank you, Richard. Hearing both you and Alyssa speak highlights the importance of taking an equity approach to this work, because as you said, whether you're in a low, moderate, middle income, or high income country, not everybody is able to access immunization at the same rate. So that focus worldwide is really important. And I appreciate you joining us today to share UNICEF's work, and Alyssa, for you to share the innovative approach taking a gender lens to immunization. I wish we had more time today. Thank you for your time. And thank you, George and Ideagen, for having us today to talk about the importance of immunization around the globe. Thank you.
Thank you.